Hello all, welcome to PharmaNandan. So in the earlier videos, we learned something about the gout, the pathophysiology, and the treatment options, right? Among them, we learned NSAIDs and xanthine oxidase inhibitors, right? This is the part 3 video, and this is last video for pharmacotherapy of gout, right? So without any further delay, let's proceed. The first thing we are going to discuss in this video is uricosuric agents. What are these uricosuric agents? Uricosuric, uric, you can see here, right? This is uric acid, uric, that is the agent, the drug which is going to eliminate this uric acid through urine, right? That is, these drugs are going to increase the concentration of urine in the nephron so that it will be excreted in urine. Okay, so it avoid the uric acid pooling in the blood vessel, in the blood vascular system, right? That is the purpose of these agents. Okay, this increase excretion of uric acid. Okay, so this is a schematic diagram. So this is renal blood vessel, you can see. This is schematic representation of nephron. Okay, so this is the end product, the end urine which is formed here, you can see here. Okay, it is eliminated from here. Okay, right? So what is the thing happening here? Okay, this is the apical side of nephron and this is basolateral side. That is, it is having a unilayer membrane, right, between this blood vessel and this nephron, right? This is apical side and basolateral side. There are many transporters. Among these transporters, two transporter names we should remember here. The first transporter name we should remember here is URA, uric acid. Okay, T, transporter 1. OAT, organic anion transporter 4. So what is the purpose of these transporters? These transporters, the tendency of the property of these transporters is it will move the uric acid from the nephron into blood vessel, right? We call it as reabsorption. Okay, both the transporters for the exchange of some anion. Okay, so our task is to block this one from apical side so that uric acid is not reabsorbed. Okay, what are the agents which are going to block these channels, or what are the agents which are going to compete with the uric acid? That is, when 10 molecules of uric acid there, for example, this drug will compete with this uric acid and those drug will go with the exchange of anion. Okay, so we call it as inhibition of these transporters from the apical side. What are those agents which are going to inhibit these things? This channel, urate 1 channel. Okay, inhibiting this channel and inhibiting this channel. Okay, what are those agents? The drugs which are going to inhibit this urate 1 channel are, first thing, probenecid. Yes, we all know. Next, lesinurad. Third, benzobromine. But this benzobromine is not USA approved, so it is available in other countries but not in USA. Losartan, along with antihypertensive property, it has this uricosuric property also. Etodolac NSAID also having uricosuric property, and dotinurad. These are inhibiting these urate 1 channels. Among them, this lesinurad has one more additional property. It can block this OAT4 transporter also, organic anion transporter 4 also. Lesinurad binds with these two channels, the urate 1, uric acid transporter 1, and organic anion transporter 4. Both the channels are having lesinurad action. Okay, the all the other drugs they block urate 1. Okay, uric acid transporter 1. Understood? And one more thing here is this dotinurad. One point you should remember, it has a side effect of nasopharyngitis. So what are the properties of the other drugs, that is this probenecid, lesinurad, and these things we will discuss in next slide. So let us confine our discussion to probenecid. Okay, the first point we should remember about this probenecid is this is actually um, having a one property along with sharing along with the allopurinol. It should not be given alone because it is also having tendency of flaring up the gout attack. In the beginning days, probenecid is not given alone as monotherapy. Okay, that point, the main point we should remember. And there are some contraindications which we should remember for lesinurad. The first contraindication is yes, if a gout patient is having nephrolithiasis, don't give probenecid. Okay, what is the other contraindication? Yes, when there is any overproduction of uric acid. Yes, when uric acid production is normal, but there is some problem with this excretion or elimination, then we can use this probenecid. But the fundamental production itself is more, for example, of this uric acid, then don't give probenecid. And another contraindication for this probenecid is just I said just 1 minute back. In acute gout attack, don't give it as monotherapy or try to avoid probenecid in acute gout attack. Okay, if you want, compulsorily you have to think of adding colchicine also here. Okay, and other contraindication is co-administration with salicylates. Don't do that because salicylates, I told you, aspirin, it inhibits the action of these uricosuric drugs. Okay, co-administration with salicylate, this is contraindication. Okay, why, what is the agent we should add along with probenecid in early therapy? Probenecid in early therapies, in early days of therapy, it is, I told you right, it is usually given along with colchicine because these flare-ups will trouble the patient a lot during early days of therapy. Okay, and what are the important points which we should remember about the lesinurad? Regarding the lesinurad, the first thing we should remember it is not used as monotherapy. Lesinurad should not be used as monotherapy. It should be combined with, recommendation is, common recommendation is, please combine with this lesinurad with xanthin oxidase inhibitors, allopurinol or febuxostat. Okay, why? Why not used as monotherapy? The reason is there is a risk of nephrolithiasis if you use this lesinurad as monotherapy. And what is the other risk? Acute renal failure. For these agents, main thing we should keep in mind is kidney should be functioning normal. Then only try thinking of these uricosuric agents. Okay, and one more important point with this lesinurad is when there is hyperuricemia along with gout, yes, this is used. Okay, but a person is having hyperuricemia but he is not having gout, then this lesinurad is not recommended. So we have seen a common point, right? This nephrolithiasis has a risk for this lesinurad and this probenecid. Okay, these uricosuric agents. This is the reason we often get a question assertion reason. This uricosuric acid works well. What we discussed, there is pooling of uric acid. We are trying to eliminate it through these agents. It sounds good, right? But these are not recommended as first line agent. Why? The assertion is these uricosuric agents are second line in uric acid lowering therapy, not first line. even though they are good as per our pathophysiology, right? Why? Reason is, yes. The reason is risk of uric acid stone formation. Here, yes, assertion is correct, reason is correct, and reason is proper explanation to assertion to this question. Okay, and coming to the next group, that is the last group, interesting group is recombinant uric acid oxidases. What is the thing which we should learn about this one is, so in the body uric acid is there. We know uric acid is not so greatly soluble, right? This uric acid, to make it as soluble, there is an enzyme called uric acid oxidase. Okay, what does this enzyme do on uric acid? It makes the uric acid more soluble and more inactive by converting uric acid into allantoin, right? What is the property of this allantoin? It is more soluble, more water soluble, so that it can be easily flushed out of the body, and it is not aggressive in the body. It is highly inactive. It is totally inactive, allantoin. Okay, so what if we synthesize some product which mimic uric acid oxidase? Fine, right? So there is recombinant technology, we know, right? Based on this recombinant technology, uric acid oxidases are synthesized based on uric acid recombinant technology. Two things are there, two drugs. Number one drug is pegloticase and rasburicase. These two agents are recombinant strains of recombinant things which are synthesized by, which mimic the properties of uric acid oxidase enzyme, right? What are the things which it can do? This pegloticase and rasburicase, it mimics the action of uric acid oxidase. It converts uric acid to allantoin, which is more soluble and inactive, and it is excreted in urine. Fine. How much time that these will take to decrease the serum uric acid level in the body? This pegloticase and rasburicase, within hours, within hours, we can appreciate serum uric acid levels are decreased. Okay, then everything is nice now. So then why these are not recommended as very commonly? Because these are recombinant technology, these are designed and synthesized by recombinant technology, right? So the main most common side effect which occurs is in almost 90% of the patients when there is any foreign substance which act coming through recombinant technology. Okay, we can expect antibody formation from the patient. So these drugs will act aggressively, it will give greatly effective, but antibodies are formed very soon within months. Okay, so these are um, given very rarely, not in the as a first line. Okay, so what is the use of these drugs? Pegloticase. It is used in the treatment of when it is severe case of gout, then try thinking of this pegloticase. And when there is gout in which all the treatments are not working properly in a patient who is suffering a lot, treatment refractory cases of chronic gout, then think of administering pegloticase. Okay, then what is the purpose of this rasburicase, role of rasburicase? First point, these are not used in chronic gout. Where is this rasburicase indicated then? Eventually, we know it is not indicated in acute gout, right? So, what is the purpose of this rasburicase? Why we use it usually is, see, let us they discuss about cancer chemotherapy for few minutes. Cancer chemotherapy, in whom assume it is in both pediatrics and adults also. Which type of cancers? Leukemia, lymphoma, or take even solid tumors. Okay, both hematological plus solid tumors. Okay, what is the thing which usually happens in cancer chemotherapy of hematological or solid tumors, either in pediatric or adult group? The one of the common side effects which we see in cancer chemotherapy is tumor lysis syndrome. Yes, and another side effect usually we see in cancer chemotherapy is in the serum uric acid levels increase. Okay, all these occurs due to side effect of cancer chemotherapy. Okay, these both of these things. Okay, when a patient is given cancer chemotherapy, which who are having hematological, maybe solid tumors in pediatric age group or adults, and which we among whom we expect tumor lysis syndrome or serum uric acid, then the hero is this rasburicase. Then this rasburicase is given for these two conditions. For tumor lysis syndrome, anticipated tumor lysis syndrome or anticipated serum uric acid level rises. Okay, it is not actually used in chronic gout. Okay, so in the previous session we got it right. What are the xanthine oxidase inhibitors which are used as the first line used urate lowering therapy, right? What is the second line? Yes, we got the answer right. What are the second line of urate lowering therapy? Uricosuric agents, which are probenecid, lesinurad, all these things. Answer is probenecid, lesinurad, etc. Okay, this benzobromorone and losartan and dotinurad. Okay, so by now, by pharmacotherapy of gout is completed. Okay, by this, the pharmacotherapy of gout is completed. Okay, for any queries, feel free to write email to pharmanandan at the rate zohomail.in. Okay, and if you like this video, please subscribe to this channel and like and comment and share this channel and share this video to your friends and peers. Okay, and if you have any topic in your mind so that we need to discuss in this channel, feel free to mention it in comments so that I'll plan to post those videos as soon as possible. Okay, the topic which you want to discuss. Meanwhile, subscribe to this channel and like this video and share this video to your friends and peers. Well, thank you for watching and see you soon again in next interesting video.